Welcome to the Catherine Vandome and Me podcast.
Hashtag hosts and the HQFM Quiz and Bingo software are proud to sponsor the Catherine Vandome and Me podcast. With HQFM Quiz and Bingo software, you can use this interactive quiz software at any venue. All you need is an internet connection. Go to hashtagquiz.co.uk for your free trial today.
Hello and welcome to Catherine Vandome and Me. I'm Catherine Vandome and I'm a stand-up comedian in recovery from very severe ME. I'm also a published author and my book is out now. It's called The Truth About Me by Catherine Vandome and it's all about entertainment and health and my recovery journey. And speaking of my recovery journey, today's very, very special guest, as the podcast is all about entertainment and health, is an incredible man who is a Perrin practitioner. He is qualified in Tai Chi and cranial sacral therapy, and he's absolutely incredible, and he's inside my book. It gives me the greatest of pleasure today because this particular gentleman is also my partner. And it gives me great pleasure to introduce Mark Singleton. Hello there, Mark. How are you?
I'm okay, Cathy. Thank you very much for having me on.
It's an absolute pleasure and thank you for coming on today. And today is all about celebrating your life and your achievements and also celebrating you because you have such an inspirational story that I think will resonate with people all over the world who are diagnosed with the chronic health condition ME. And your journey is so incredible that you've been an inspiration to me from the very day you helped push me in a wheelchair, carried me on your back and helped me on my past 11-year journey to recovery to this position today. So first of all, I want to say a huge thank you for helping support me through to this point over the last 11 years. And most importantly, today is all about you, Mark, because you have had an incredible journey, which I think people that are watching today will be hugely inspired by, because today you are helping to save lives. And just give me a little bit of a brief synopsis. You've had ME yourself for 3 decades, and today you have empowered yourself to go and help and serve the community in Fulwood in Preston, where we're from, and you're giving back to the community by treating patients with this chronic health condition. And just tell us a little bit about you and your job position today, Mark.
Well, yeah, I work locally treating people with ME, long COVID, fibromyalgia, mostly just doing the Perrin Technique on people like that. You've had Ray Perrin on, so you know all about the Perrin Technique. You've had the Perrin Technique for as long as I've had the Perrin Technique. So yeah, we started at the same time. It was your idea. You came up with the idea of, you chatted to somebody and they had a story of how they'd recovered. You found out about Ray Perrin and we went to see him. And that's where this journey started, which ended up, whatever, 7-8 years on, ended up that I trained as a Perrin Technique practitioner and now treat people in the clinic just here in Fulwood, just locally.
That's fantastic. That's absolutely fantastic. And first of all, I want to say you worked at the Perrin Clinic. So just give us a little bit of, synopsis of how you got to work today at the Fulwood Therapy Centre, Mark, and how you began at the Perrin Clinic itself, working under the tutelage of Dr. Raymond Perrin after you'd qualified.
Years and years ago, I did massage training because I've done Tai Chi a long time. All my Tai Chi teachers had a background in massage, and I thought to get to know the human body better will be an important part of my training. So I trained in massage, which was a prerequisite for being able to train in the Perrin Technique. Also, as doing the Perrin Technique, you need to know craniosacral therapy. Osteopaths will have it as part of their training. If you're a physio or a massage therapist, then you would have to do additional courses. So I started doing craniosacral therapy and really enjoyed it, and I've done a lot of training in that over the years. And so with the massage and with the craniosacral therapy, and also because Ray Perrin knew me very well over the years, and we always got on really well, he invited me to start working at the Perrin Clinic, which I was thrilled about, and to work basically, under him, so I could observe him. I've obviously observed him quite a bit, watching him treat you and also him treating me. So yeah, it's a nice position to be in, to have gone through the treatment and know where people are step by step with it. And yeah, it's really satisfying and rewarding to see people slowly improving and guide them along in their steps and treat them to the best of my ability. And so that started at the Perrin Clinic and moved to Forward, which was really useful and nice. Of being at Forward is, I see the same people and I see them progressing. And yeah, that's nice.
That's wonderful. Can you just tell us a little brief about what the Perrin Technique is for anybody that's tuning in today for the first time, Mark? What is the Perrin Technique treatment for ME?
The Perrin Technique treatment is a manual treatment based on osteopathic principles, where we work on the structure of a person's body in order to enhance their function. Specifically with the Perrin Technique, you're working with lymphatic drainage and neurolymphatic drainage, which Dr. Raymond Perrin has been suggesting strongly that this has occurred for the past 30 years, and only recently have scans caught up to the fact that this actually happens in the brain. Lymphatics mean the cleansing of toxins. The lymphatic system cleanses toxins out of your system, out of your body, and a dysfunctioning in that realm has knock-on effects. And there are certain structural factors which ME patients have, which we then work on and improve that neurolymphatic drainage, and in so doing reduce the symptoms of ME long COVID.
That's fantastic. Now we understand that because obviously we've been very committed patients to Dr. Perrin for many years, and I thank you personally for because you were sort of carrying me in and out of the clinic. I was so severely affected. And what was your inspiration to actually become a fully qualified, and you've also gone on to qualify in advanced cranial techniques at Upledger? What was your drive to do that, considering you had ME yourself for 3 decades? Was that your drive behind it, Mark?
The drive behind it was, I haven't really questioned it. I always thought if I could find something that was effective and useful, that I would help people using it. I had that, made that bargain with myself in some ways years ago. I was like, if I find something that's useful, I will dedicate myself to treating people in it. That's
brilliant, because I know you as a very caring man, and you really do transcend that in your treatments as well, because obviously you're symbiotically with Dr. Perrin treating myself also. So I can say firsthand that you have a natural healing gift. Not everybody has that, and I want to say today, you have not only walked the walk, taught the talk, but you've also built up the skill sets over the years in qualifying, and also, as you say, they transcend your Tai Chi. So just tell us a little bit about your Tai Chi, because you're a qualified Tai Chi instructor, is that right?
Yeah, I've studied with a lot of people over a lot of years, and I still practice daily and have done for 23, 24 years, a daily practice. And I started a couple of years before that and found some good teachers who really knew about it. As you mentioned, I've had it at ME for a long time. When I was in my early 20s, I was looking for things to help that, and I saw a book, I think it was called Qigong, The Way of Energy or something like that, and I thought, well, I've got no energy, maybe this will be helpful. So I started doing little bits from the book, and then looked at the back of the book to find a teacher, found that guy, and then one thing led to another, and I just carried on getting deeper and deeper into it. And I did find that slowly but surely it did help. I used to have Raynaud's, which is basically a lack of blood circulation to the toes and the fingers. That resolved itself over the years. I generally felt better doing it, and it's not too hard to motivate yourself to practice when you know you will feel worse if you don't practice. So I've been consistent like that. So yeah, I thought there's a possibility like I could be a Tai Chi master. I didn't in my head at that time think there was a possibility of me ever getting better, but I thought if I was a Tai Chi master, I'd be better. So if I can believe in that, I'll head for that and hopefully feel better.
And how long have you been doing Tai Chi, Mark? Because I know you've been teaching Tai Chi throughout Lancashire. So how long have you been a Tai Chi teacher? That's hard to say.
Tai Chi teacher, yeah. I think the first qualification I got was 2006, so 18 years ago.
Wow.
And helped my teacher out for a little while in his classes, and then started doing my own classes, so about 16 years ago.
Up Ledger, just tell me a little bit about the advanced cranial sacral therapy that you're doing.
Well, cranial sacral therapy, the hands-on stuff that I do every day with Perrin, some of that is basic. Cranial sacral therapy was part of cranial osteopathy, and a guy called Dr. John Ledger from America said, well, people who aren't doctors of osteopathy should be able to do these kind of manual treatments. So he started creating the discipline of craniosacral therapy. So it's hands-on, very subtle treatment of the skull, cranial and sacral, which is the tailbone. So head and tailbone. So treating the spine and and the body in a very subtle way, which is, it's interesting. You put your hands on not to make something happen in that person's body, but to allow what's going on and contact the intelligence of the body to balance itself, to right itself. So I'm not healing anybody. I'm facilitating perhaps them going into a state where their body can resolve whatever issues, improve health and what have you in various ways. And specifically, obviously with the Perrin technique, it's for improvement of reducing the symptoms of ME, long COVID, fibromyalgia, those kind of things.
Wow. And just to explain how that would work, just for anybody watching today who has any of these health conditions, how does the craniosacral therapy and the Perrin technique help? What is it that it actually activates?
So if we think of ME and long COVID to be inefficient drainage of the neurolymphatic system, treating with that gentle craniosacral therapeutic touch will encourage that to drain and to function better over time. Most people with ME and long COVID will find over time that there's a reduction in their symptoms through this treatment method.
Wow. So what I want to do now is I want to hear a little bit more about your journey.
Is that many years ago, I got the Perrin Technique book and just gave it a cursory glance to look over, because after years of having ME and being ill, there's so many fads out there. And my expression was always, yeah, everybody gets better from something. Do you know what I mean? Like, so I dismissed it, really. That and a few other things, which I was probably right to dismiss. But when I went to see you, we both went to see Ray Perrin, met him and thought, no, he seems a decent guy. He doesn't seem like he'd do anything other than try to help people. And once I got that impression, I was like, well, okay, let's see what this has to offer. And then I'll work at it. I'll do exactly what is required of me, the self-treatment at home, and come to see him for as long, for a certain amount of time and see what happens. PhD in neurobiology, the topic of which is his work in ME. He's also an honorary research fellow at the University of Manchester and also at UCLan. So he's been published in the online journal of the BMJ with regard to assisting using the Perrin technique science to assist the diagnosis of ME. The study was successful and lent evidence toward the proof of concept for what he's saying, that ME people have these particular signs that you can then work on that will help improve their condition. So yeah, he's an enthusiastic scientist and practitioner of those disciplines. So it's not just he says he thinks, or he's got this idea. He's quite happy to, though it takes time and funding is difficult. It is very tricky to get funding and to get the time when you're a busy person like Ray is, training people all around the world, treating patients and doing scientific studies to get evidence towards it. But he's a very much an evidence-based practitioner, and I like that about him.
And so you basically qualified under his tutelage. You then also worked at the Perrin Clinic itself, and now you're at the Fulwood Therapy Centre in Lancashire, Preston, Lancashire, and you're treating so many different patients with lots and lots of different backgrounds as well. Is that right?
Yes, it is. Yeah. I also suggest that they see Ray every 12 weeks or so. Before I started working at Forward, I thought, what would be the best care if it was my closest family members, my closest friends? What would I want for them in the setup of the practitioner? What kind of treatment they would like, and I'll be like, yeah, seeing Ray once every while, so I can ask him any questions that come up, or so he can see them to see how they're progressing, and seeing me on a more regular basis. That to me, I was happy for anybody that I know and care about to go through that. So that's the standard of care I want for my patients as well.
And like Qigong, they're going to the Perrin master, which is the main guy, Dr. Raymond Perrin, that's created this. But obviously, because as you say quite rightly, he's extremely busy now globally, going all over the world treating people. The great thing is he has Perrin practitioners now who are getting qualified all over the world, and the UK in particular, where we are, you are now facilitating this in Preston. So if anybody wants to come to you, and we'll remind people at the end, what's your connection website so that people can actually find you, Mark?
It's marksingleton.me or .me.
Yeah.
My information's there. You can email me there. My phone number's on there, and you can find it through the Perrin Technique website. If you go on the Perrin Technique one, there's a find your nearest practitioner, and if I'm that guy, then click through and contact me if you want.
That's great. That's great. So you really are serving the community, and which is a very selfless thing to do, considering you've had an entire lifetime of this chronic health condition, which really does strip away a lot of our abilities and opportunities that other people perhaps don't quite understand. And that's why I wanted to invite you onto today's podcast, because you are the master of ME, in my opinion. There's a lot of people who I've had it diagnosed for 11 years, but it seems I've probably had it from birth, gradually getting worse and worse, toxic buildup. But in your personal case, you've actually lived with that diagnostic, about 3 decades now. And that's quite a long time, Mark, for somebody to live with a chronic condition. What drove you to keep going? That's a very big question. What drove you to keep going, to find those answers decade after decade, Mark?
I don't know if I was driven to find those answers. Not like when we got together, you hadn't been ill for that long, and it was all fresh and all new, and you were the one who was the driving force to look for more answers and new things. I was more managing it and mitigating it, and just looking at it being like, this is my life, I guess. Tai Chi helps, meditation helps, getting my diet right helps, sleeping right, pacing, those kind of things, they help. And it was more a management of it, but you were more of a firebrand and more driven to find those answers. So I'd say I was managing it to begin with. When I got ill when I was 20, and when you're 20, you think, yeah, I'm just going to bounce back out of this. I'll be fine. I was always strong. I was always healthy. And then for it to drag on even months is a bit like, I started complaining to my friends, oh, I'm tired and that. And then I stopped because I didn't want to seem weak. I think that's a big part of it. So I kept a lot of it to myself, which perhaps not the smartest thing, but it was the 90s. What are you going to do? And then I did go through a period of being very depressed and feeling very down. And at the worst of that, I got hair mineral analysis, which basically back in the day when I had hair, I got it analyzed, and a lot of, even if it was the most accurate testing, and I don't know whether it was, even if not, my mineral analysis was so way off, several standard, 2 or 3 standard deviations away from the norm for certain things, that was like, oh, no wonder I'm feeling horrible. Here at last is a physical manifestation, representation. One, that there's something up with me. 2, there's something I can work on. So I went to see the person who suggested those mineral analysis was a Dr. Wendy Denning she was then at the Integrated Medical Centre in London. And that was at least a path towards something, because before then I was doing a little bit of yoga because I found a book on it and found that I could sleep a bit better doing it. But that was really my path towards, all right, there's something I can work on here. I can improve my diet. I can take these minerals, and things did get slightly better from that low point in health there. But yeah, I was very depressed. I sought counselling, and the counselling helped with the depression, but it didn't make any difference to the baseline body messed up and jacked sort of thing.
So what I'm hearing you say, Mark, is back in the 90s was when you first got diagnosed with this condition. As Dr. Perrin says, there's usually structural issues that precipitate this condition in many cases, till eventually he calls it putting your finger in a light socket and the whole system blows, and then it's much, much harder to come back from that. But you obviously had this diagnosis from Dr. Wendy Denning. And can you tell us a little bit about her, Mark?
Yeah, she was trained as a GP. I think she might be Canadian, I don't know. But she was a specialist in ME, which is what I was looking for, or chronic fatigue syndrome, as she called it. And yeah, I think a few other things, but that specifically. So she had the Western medical background, and she was also, as the name of the place, Integrated Medical Centre, you integrate in some alternative approaches with a more mainstream.
And what's nice about her, when you told me this, was that she believed you. Is that right? That's the important bit, Mark.
Yeah, I mean, I've not really, I didn't tell a lot of people. Obviously now I'm working in the field, it's a little bit different, because that's part of my calling card is I've had ME for a long time and I know a bit about it. But yeah, I didn't tell many people. So being doubted, and I wasn't bedbound, which I'm very fortunate for that to be the case. I just couldn't work as much, couldn't do as much. Yeah, so I had no reason to expect being down. And also my family knew that if I was complaining about something, then it was serious, because I didn't really complain very much. So yeah, it was more so, have you felt chronically fatigued for an X amount of time? Therefore, by definition, you have chronic fatigue syndrome if it's over a certain amount of time. I think that was her line of diagnosis to,
Yeah.
Not as comprehensive as what Ray Perrin does to assess you.
Yeah, so what I'm hearing you say is Dr. Perrin, when you met him, which would be decades later with myself, 2016 it was that we met him, and we're so lucky to meet him, of course, he then did an assessment on you, didn't he? Because am I right in saying that there are a subset of patients who do have clinical depression and or clinical anxiety and not ME? And what Dr. Perrin does in his physical assessment is find the difference between the two. You tell me a bit more about that, Mark.
Yeah, what Ray Perrin is looking for is structural deficits or dysfunctions that would presuppose dysfunction in your lymphatics and neurolymphatics, and hence the problems with buildup of toxicity and leading to ME. So he would look for that. One simple heuristic, simple acid test is, what does exercise do for you? If you are depressed and you exercise, you will feel better and continue to feel better. If you have ME, you might feel better in the short term, but within a 72-hour, 3-day period, you are going to feel the effects of that. And if it's exertion, really, and if you exert yourself beyond your bounds, and exercise is an easy way to do that, then you've got ME.
Yeah.
If you're smashed and battered afterwards, rather than, and I don't just mean like you've worked out hard and you're aching and stuff. It is flu-like symptoms. It is cognition worse. It is mood worse. It is the lot from exercise, which we know is incredibly good for mental health generally for people who can tolerate that.
Fantastic. I think you've just explained that very succinctly, Mark, and thank you, because anybody watching, imagine all over the world today, they're watching, they're tuning in, they're thinking, I used to be an exerciseaholic, which I did, you did. Those tend to be hardest hit. Am I right?
Yes, you almost exclusively see people in practice who have the capacity to really push themselves hard for whatever reason. There's used to be a misnomer of like, oh, they're kind of just faking it, they're lazy people, what have you. You tend to be the people who can push themselves very hard and are inclined to do that, and may have done it successfully, as it were, or managed it for decades before, as you say, Ray says, that kind of electric shock moment where the system is kind of fried and done, and you need to repair and treat it differently.
Yeah, absolutely. And I mean, I'm a type A personality. Would you consider yourself to be a type A personality, Mark?
I don't know. I certainly am willing to push myself hard.
Yeah.
And I used to do it physically in the gym. I used to love training in the gym. I started lifting weights when I was 13, got my first set of weights then. And yeah, I like to challenge myself in that way, definitely.
And I think that's really, really important to share today, that both of us were exercise aholics in a way. We did push ourselves to the extreme, certainly physically, but also mentally. It's not just the physical exertion Dr. Perrin has shared with us both, it's also the mental exertion. So if you are a doctor on call and you are doing a very long day and night shift combined, then you are pushing yourself. You're not looking after your sleep, you're not your meridian cycles out of whack, and all of the natural survival modalities, good diet, rest, relaxation, all of those jigsaw pieces that Dr. Perrin in his book, The Perrin Technique, highlights, that are absolutely quintessential to recovery from this. You've almost got to start from the very beginning and start all over again. Would you agree? You've almost got to eradicate your old thinking patterns in order to help to get yourself better. Would you agree?
You've got to meet whoever comes to see you where they're at, and that might not be where they're ready to change everything, as it were. But yeah, over time, adjustments have to be made. Pacing, it's not even, most people who come see me, they've hit the point where it's not negotiable. They can't just do a bit of this, a bit of that, and I can get by. It's that they've hit, if you want to use the term, rock bottom, and they need something to recover. So they're starting from a very low ebb, which is terrible in one sense and good in another, in that they're ready to take on board, as you say, changes in outlook and action.
And I think that's important to share, because Dr. Perrin has always shared with us that the sad part of this is people go down the medical Western modalities and they try absolutely everything in many cases. And the more severe patients, like myself and you, were long term, so considered severe as well. But I was a very severe bed bound. So the more severe you are, then you are going to do anything and everything to try and get better. And I think that is, if you like, nature's way of saying, right, this is, you've done it, you've lived that life, now open a new door and walk through there, because if you can, because the most important part is reassessing how you've lived your life. And as you quite rightly said, that is a process, and it certainly was for both of us. It's you can't just wake up one day and change everything, your diet, meditating, tai chi, all these different modalities, as you quite rightly said. And I love that you said that. You meet the person where they are, and then you guide them through sharing your story, as you are doing today, because that is really the best way to help others and those who are ready to take that plunge, because it can be a very difficult journey. It is like climbing the highest mountain. It absolutely is. It's a very difficult journey, but it's absolutely essential to look at other parts of the jigsaw: the rest, the pacing, the meditation, the diet, bit of yoga if you're able to, and reassessing your whole life and sometimes even your job, in my case, which I can no longer do. So it's looking at a different way of living, and just take us a bit further on that, and on what you had to change, Mark.
Well, yeah, I didn't take your very good advice when I started. When I started with ME, I pushed myself harder, just thinking I just have to train harder, push through it, and what have you. And it did make me worse. And I was working a lot of hours at that time. So yes, I had to give up I used to enjoying more physical martial arts like Thai boxing and lifting weights, and eventually I had to shelve those. And as I've just explained, I do Tai Chi now, which is much gentler. It'll give you energy back. It'll help you get into that nice parasympathetic relaxation state, as will meditation. So yeah, my focus had to come onto those things. Fortunately, those things fascinate me as well, and I enjoy them. But yeah, it's a hard thing to give up a more physical and dynamic life, and also going out, and I wouldn't go out as much, or if I did, I'd be like, well, I'm going to feel horrible for more than a week, so I may as well go big or go home. So that wasn't smart. Actually, probably best off as I do now, not bother drinking. But yeah, it's because I was into training. I wasn't too bad about wanting to eat healthy and that kind of thing. But yeah, I was on a specific diet with Dr. Denning, and yeah, I tweaked it over the years to find what was useful for me. I wasn't always perfect at it, but those kind of things, not being able to do stuff, it's a lot to get your head around when you're younger, definitely. Or anytime, really.
I was just going to say, and for you personally, how old were you when you were diagnosed? Were you 20?
I was about 23 when I was diagnosed. I was 20 when I got ill on holiday. And yeah, just the doctor, when I went to the GP after like a month or two, he said, oh, it's probably a virus, which I didn't really realize then is basically what they say when they're like, well, we don't know what's up. It's probably a virus, you know. So that spurred me on to start looking at alternative stuff like the yoga, like diet, and then eventually, you know, seeing doctors who have a different, more broad or holistic view of things.
Fantastic. And that's really, really empowering to hear in today's world where we are looking at alternative healing modalities for the mind and body. And you very much work with mind and body in your practice, don't you? Because you've now just recently qualified in emotional somatic release. Just tell me a little bit about that. And with the beautiful Anna Bianchi, who's also been on our podcast, who is incredible in healing as you are. And you worked together, didn't you, at Up Ledger? Is that right?
I do work with Anna. Anna is fantastic. Really glad. Just the way it worked out, we're both involved with the Perrin Technique to one degree or another, and we were on our first course together, and then done most of the courses with it. Just pure coincidence, more or less, that we've won those courses. Yeah, somato-emotional release is based on the idea that the body. Bessel van der Kolk, I think his name is, a famous psychiatrist, wrote a book called The Body Keeps the Score. So if you're working in a subtle way with the body, there is potential to release trauma-based stuff or tension-based stuff and emotions whilst you're doing this subtle work with the cranial sacral therapy stuff. So that kind of blends and bleeds into the work sometimes. It's very natural. I've said to you many times the phrase the issues are in the tissues. It's not just, oh, we have this thing that happened and it's in the mind. It's in the body as well, and resolving things around those can come up. Some people sometimes see me specifically for work like that, and sometimes it will just come up as part of the Perrin technique as well. Not always, and you don't have to go after it or what have you, but yeah, it's working on that level with the body and its intelligence.
And that's interesting because Dr. Perrin taught us that when we cry, we release toxins, chemicals and cytokines, etc. They build up in the brain and they're unable to drain out efficiently like a healthy person because of the structural issues. Am I right about that?
That's part of of the equation. Also, the fact that if a body is in a stress state, what we call a sympathetic fight or flight type state, that will contract the lymphatic vessels, and the lymph won't move as well through. So that can be another effect. But also emotional stuff, traumatic stuff is held in the body, and those patterns of tensions can affect the functioning of the body as a whole in subtle and sometimes gross ways.
And I think that's important to share because, you know, that's been the issue all along with ME for 100 years before the NICE guidelines changed in 2021. I went to Parliament, and so did many others, I'm sure, fighting to change the NICE guidelines from a psychological condition to a physical condition. And it was the Right Honourable Ben Wallace, my MP, the ex-Defence Minister, who came to visit me in my home. And 3 months after I took Dr. Raymond Perrin with me to see him in Parliament, 3 months after, he wrote to me to say that he has written to NICE and put forward a strong case to change the NICE guidelines from psychological to physical, because it was obvious to him from seeing myself, and I had a broken flue pipe emitting carbon monoxide in my kitchen. There was a real evidential base there, and physical, you know, an obvious potential cause and effect, or at least one of, that he supported me. And that's really important to share, that he really was very supportive. And I believe, you know, he was very supportive to you too. Is that right, Mark?
Yeah, really useful as a constituency MP. He was handy. Yeah. There's a lot of skepticism around. If you've got ME, you'll have felt or explicitly had the judgment of others implying, yeah, I get tired too. Oh yeah, you just need to snap out, but you just need to do a bit more and push a bit harder. And certainly when I was younger, there was a bit of me that believed the cultural zeitgeist of, oh, I've just pushed through it. And no, like, one of the great things about Ray's work is is the amassing of evidence towards, no, there's physiological stuff going on that is there that we can work with. It's not just all in your head, which is a very dismissive and not particularly helpful way of thinking about things. So yeah, I applaud any movement towards it being accepted as, yeah, it's, you know, mind and body aren't two separate things, but it's not just an all in your head sort of thing.
And it's definitely not clinical depression or clinical anxiety. And they have, the psychiatric camps now have confirmed that. So, you know, our mission is...
that being said, you can have comorbidities. You can have
Yes.
ME plus other stuff. It doesn't mean you're not depressed because you have ME. You could have both of those things, and complicates the picture somewhat. But yeah,
Absolutely.
It's not the cause of that fatigue solely. Yeah.
That's really important. So the differentiation between any psychological condition and this particular physical condition is that with ME, you get post-exertional malaise. Hello, Mark. Now, what I want to do now is just bring on what I consider to be our son, which is Tinker. And he's just going to give you a little wave. Look who that is. There you go. And he's my co-host on the Catherine Vandome and Me podcast. And he's been on all of the shows throughout and watching throughout. He's very confused as to why you're over there. Yeah. And it's lovely because what you also do, just take us through what you do. You also help treat Tinker as well, don't you?
I'll do some what is known as myofascial release on him. So I'll do a little bit of doggy massage where it just go very, very easy with the tissues, and stuff kind of relaxes and releases. It's no big deal. I don't know if I treat him. I don't know if I've healed him from anything. He still can't hear. He still can't see very much these days. If I wave back at him, he's not going to know. I know that.
Just have a try. But yeah. He's 16 and a half, isn't he? So so he's done very, very well. And I think his life extension is definitely, you know, you've almost done the Perrin technique on him. And we had a friend who you also did some myofascial release on my friend Rolf's cat. Just tell me what happened there.
Yeah. That cat was quite relaxed afterwards. It was literally like the first or second day that I started learning the stuff for cranial sacral therapy. Rolf very kindly put me up there, and I just did a little bit of what I'd learned that day on the cat, and he was asking me, what have you done to my cat, because he's a bit mellow and he's kind of staggering about the place. He was fine. He was better.
And so, healing does transcend animals, because Dr. Perrin was saying, elephants, and there's people doing the lymphatic drainage on lots and lots of different animals. If anybody has a little animal that's struggling, have a little look at the Perrin technique and just gently draining the cranium, and also, massaging the tummy, massaging the legs. That can also help our little cats and dogs and animals as well. So the most important thing is that we're looking after not just our own health, Mark, but also our little tinker as well. And for anybody out there, once you start learning the treatment of the Perrin technique, and I feel that it can help beyond ME. I think it's something personally that would possibly help, other conditions. And it's a little exercise that people can practice on themselves once they understand the self-massage part. And what would you say to anybody that's starting out doing the self-massage, Mark? Because sometimes people feel quite a release of toxins in the early stages. What's your advice there?
Yeah, the inclination is, I think, with the self-treatment to go a bit more firmly. And Ray Perrin says, do it like you're stroking a cat. So very, very gentle, because, like, as you correctly said, it could be that moves quite a lot of toxins for them, and their system has to cope with that. And yeah, gently. What you want to do is get your body in a nice, rested, relaxed state more and more of the time. That's why you pace as well as you possibly can. That's why you go gently with the treatment. And in that state, your body is more apt, more capable of healing itself.
I was very impatient as a character, a bit like my nana. My nana once said to me, would you come and help me, years ago, would you come and help me to clean the kitchen? And by the end of the day, we had both redecorated the entire kitchen.
Mm-hmm.
So
sound like anyone I know.
So when you've got that kind of type A character, everything has to be done yesterday, not even today. That tends to transcend a lot of ME patients. And that's why my book, I feel, should also support and encourage people, because the truth about me is my life story on stage in entertainment, but also in exercise as well, like yourself, people who do high levels of exercise, sport athletes, entertainers, army veterans. They're people who are hardest hit with this condition because they've been so physically and mentally active. And on that note, I just want to take you back, if I may, back to your childhood. So thank you for sharing some of your recovery modalities in the camp of ME. And as you say, you've had it from age 20 and you're now 49, I think. So you've had that quite a long time, and you've endured that condition, because it is an endurance. But I'm so proud of you, because only somebody with a kind heart like yourself would take that condition and then turn it into good for others. And you're also a very caring, considerate man, and people in your care will be in the best hands. So now we're going to take you back, Mark. I just want to hear a little bit about you and your upbringing, and your parents' names, and where you went to school. So first of all, where were you born, Mark? Exactly where were you born?
I was born in a village I was born in a hospital in not too far away from here, just outside of Preston, and grew up in a little village called Broughton. And I had two older brothers and a mum and dad. And yeah, it was a really nice upbringing.
Wow. And your older brothers' names?
There will be Paul and Derek.
Paul and Derek. And your
Yes.
parents' names, Mark?
Maureen and Jim or James Singleton.
And your father is important in this because your father is also in my book. Before he sadly passed away, he wrote a little quote to include inside the book. And your story is at the end of my book as well, because I thought it was so powerful. We had to have you included. And so your father opens that particular chapter, and just share with us what your father's job was, because he was a lovely man, wasn't he?
Well, yeah, he was. He was a consultant clinical psychologist at the very hospital that I was born at. Yeah. So he worked there. He was the head of clinical psychology there before he retired many years ago. But he did that line of work.
And that was in Royal Preston Hospital, wasn't it? Head of
Yes.
clinical psychology. So a very good position to be in when he discovers, of course, that his son has this condition and it's questionable as to whether it's psychological. What did he feel?
Well, based on the fact that he had had a couple of patients who had presented to him with severe mental health issues prior to getting ME, and then got ME, and he could see the difference in them. One, them having physically relatively healthy, but obviously having severe mental health issues, and then having ME and seeing the difference. So he had a pretty visceral knowledge of the difference between the two. So yeah, he was kind of fortunate in that way that he didn't doubt me or think it was all in my head.
Wow, that's incredible. So he really was an enormous influence there and a support for you. And
Yeah.
in young childhood, Mark, so you've got two siblings. What was it like growing up in the Singleton house?
It was probably pretty happy, probably pretty noisy, probably mum worried about ornaments getting smashed as we're playing football inside or what have you. It was a pretty boisterous, because it's three boys, even though they're quite a lot older than me. Paul's 5 years older and Des is 13 years older. We were playing about and running around and probably being a pain for our mum.
And your mum was a wonderful, caring lady as well, am I right?
She was lovely, yeah. She was into alternative stuff. She had books on yoga and things like that, and so there was yoga books around, and maybe alternative health type stuff, because my brother had a few allergies, so she looked into E numbers that might be making it more severe and that kind of thing. She was interested in those things.
So she was obviously a very caring lady, and she was also thinking a little bit outside the box. And your father, looking at holistic modalities as well, which is great in your youth. And your father also alternative practice, looking at the psychological components that might precipitate certain conditions as well. And he was quite a pioneer at the time, because he told me there wasn't a lot of clinical psychologists at the time. So he was one of the the first people to qualify in that many years ago. Is that right, Mark?
He was an early adapter, and he went into it thinking this is going to be a field that grows. And I'm not sure if he knew or realized that sort of thing would grow to that degree, but yeah, he knew that there wasn't many, and eventually there would be more, and it would be a growth industry, as it were.
And so two very loving, caring, kind-hearted parents, which of course you have their qualities too, don't you? Passed down, all three of you do.
Very kind of you to say so.
Yeah, well, it's very true as well. And that was something your dad always credited you with, that you're a natural healer, a natural listener, and a natural carer. So you've obviously got both parental qualities brought down there. And tell us about you as a little boy. What were you into? Because I know somebody that was your icon when you were little. So just tell us about what you aspired to be as a little boy growing up.
Yeah, I mean, I wanted to, even when I was really little, I wanted to lift weights and that kind of thing. My parents got me some dumbbells when I was really little, and I was bugging them for it. I think I was 7 or 8, and I got a pair of dumbbells. And little did I know they were ladies' weights. I would have been mortified. The 8-year-old me would have been gutted to know that. But I was thrilled to get these little York dumbbells. And so, yeah, lifting weights and getting strong, I've always had a desire to do, or like exercise and those kind of things was always an interest to me. And yeah, when I used to look in the Argos catalogs, there was a picture of this huge guy doing these like bull workers and lifting weights and stuff like that, and didn't know at the time, but that was Arnold Schwarzenegger back in the day. And so yeah, he was very much my hero when I was a little bit older than that. But yeah, I loved everything training and wanted to do more and more of that. Yeah.
And how old were you, Mark, when you started? Because you were reading his book, weren't you, as well, and following him on screen. How
Yeah.
old were you when you became his number one fan?
I don't know about number one fan, but I'd have been about 13. And
Okay.
yeah, there was a documentary that you've watched, I've made you watch, called Pumping Iron, which is all about him and his lead up to one of his last victories in bodybuilding. And that was on, back in the day, you had to put a tape in and tape it. And it was just on like a night or two before the Christmas where I got my first weight set. So I got that and then clipped the little tab off the video cassette, so it meant I never got recorded over, and then watched it 100 times because
I
I just
forgot
wanted
about
to.
that, where you've got to take the back tab off. Yeah,
Yeah, yeah, crack that tab off. Nobody's messing with your stuff.
so that your
Yeah,
mum doesn't record Heidi High on top.
exactly. Who wants that? You don't want. Yeah.
So what I'm hearing you say is your childhood was lots of fun. Were you a healthy young lad, Mark?
Yeah, I didn't ail for much. I don't think. The odd chest infection. No, I wasn't a particularly sickly child. I was pretty robust and sturdy and healthy.
And where did you go to primary school?
I went to primary school just up the road in Barton, to St Mary's New House, as it was called in those days. Very little school, but only a few of us in that year. But yeah, very nice little environment.
And were you quite a confident young lad as you are today, or were you quite shy? How were you?
I don't think I was massively shy. I don't think I was like super extroverted, what have you, but I was fairly confident, fairly outgoing, I guess.
And have you got any little stories that you want to share in your primary?
Uh, do you say it like there are stories that you have prompted me to say? I have no idea what you mean, but I'm not too sure.
There was a moment where the teacher left the class, and what did you do?
Oh, I think it was. Do you mean like? So there was two chairs in the playground, and if one of the teachers vacated, I'd plonk my behind on the chair next to them and have a little chat, not knowing that's the teacher's chair, you cheeky little so and so. But just kind of friendly and yeah, what have you.
And who was one of your teachers, Mark? We've had a guest, Helen Latham, on the podcast, and I believe one of her
Helen
relatives.
Latham's auntie is, yeah,
Oh,
Mrs. Allen, as she was known then.
wow. Wow. And she was,
Mary, yeah, formerly Mary Latham, I think would have been her maiden name.
and she thought very highly of you and you of her. And was she the teacher that you leaned on to put your shoes on, Mark?
Yeah, yeah, yeah.
She was lovely, and so you basically had a little quirky character, is what I'm trying to get to. That you were confident, you were driven, you were fun-loving. All these things are imperative in sharing your story today, so that
Yeah,
people
I don't
know
know how driven I was towards the academics. That I was all right at it, but I didn't have like a passion to study really hard. But training, yeah, I was happy to push myself in lifting weights and things like that. That always captured my imagination or
And so
enthusiasm.
when you got to high school, tell me about that. How was that? Because you went to the same high school, which was St Cuthbert Main
Yeah,
/ Our Ladies High in
it was
Fulwood.
big. We went from I think there was four people in my year at primary school, and the whole school was about 20, late 20s, 30 people maybe at the whole of the primary school, to a massive secondary school. But he was all right. I you know it took a little bit of getting used to, but I also had friends, a friend or two who were already there the year above, because we'd start doing karate the year before. So I had my little group of friends. Yeah, I was very, very fortunate that I always had my group of friends. I wasn't the coolest kid on the block, but I had my friends, and we did our thing, and yeah, it was good.
And can you share some of the names of those people, Mark, if they're watching today?
If they're watching, Michael Baines, Alan Walsh, Simon Walsh, Darren Garrido. These were my friends from my little village that went to my same school. It's all very, very nice. What can I
Oh,
tell you? Yeah.
And you're still friends today, which is lovely. And I think when you went to high school, obviously I was very much into drama. What were the subjects? Definitely sports, but what were the subjects? Because you were a natural academic. When you say you weren't so bothered, it's important that the audience hear that you were getting high grades. You were in top sets and things, you know.
Yeah, I was doing all right. My best subjects were maths and physics, I would say. Maths and sciences, yeah, those things came easily to me, as they did to my brother and probably my dad as well.
Yeah.
Yeah.
And then outside of that, you were very much into the weight training, as you say. So were you going to the gym from a young age?
No, me and my friend Michael Baines would eventually put our weight. He got some weights at a similar time to me, and then we ended up putting them all in his garage. So we had a few weights, and then when he's old enough to drive, then we started going to the big bodybuilding gym locally, sort of thing. At the age of
Wow.
so 16, 17, I started training in gyms.
Fantastic. So you were really, really quite driven by physical health and things. So that's
Yeah.
again quite important to share. You weren't somebody that was, just lying on the couch or quite sluggish, which is often misrepresented with ME. You were actually somebody that was, like myself, very physically motivated and driven. And just tell us the little story about Mrs. Connor, who was my drama teacher, who was fabulous. She really wanted you to play a lead role, and where would that have taken you? So just tell us what
Well,
what
no,
you said to get out of it.
well, who knows if she would? I'm sure the person who might be watching this, who actually got the role, was well deserved and did a much better job than I would have done. But no, she asked me to be the lead in a school play, and I was like, yeah. And uh, and she asked me, "Oh, are you available?" And I said, "What days?" And she told me those days. I think it was Tuesdays and Thursdays. And I was like, "Busy Tuesdays and Thursdays." She should have asked me when I was available, and then I'd be like, "Okay, what do I have to say?" But she did. She sent me. Do you remember Mrs. Craven,
Yes,
the music
music.
teacher? So she goes, "Go and see her," because it was a musical, let's say, and you've got to sing for her. And I sat with her at the piano, and she played "God Save Our Gracious Queen," and I did the best acting job I've ever done. And I'm not a good singer, you know this. I'm not a good singer, but I was terrible, and I tried my best to be terrible. And after that, they didn't bother me. And I think I got that from my brother, who was like, when he was ever a choir, he would deliberately sing really badly, so he didn't have to be part of it. Thanks, Paul. That's on him.
I think that's
But yeah,
incredible. So
I didn't want to be part of it, and I did think, oh, maybe I loved all that acting stuff, but no, I wouldn't have done that. I'm pretty glad how it worked out.
but you can actually act, and you quite recently went to you had some drama lessons and things, and
Yeah, and that was
you
fantastic. I really enjoyed it,
yeah, where
and
was
it was
that,
it was
Mark?
different emphasis. It was more on like television-y stuff rather than stages, a bit bigger and broader. No, yeah, it was good fun.
And that was with a friend of mine that's in the book, which is Melanie Ash, and she's got her own drama school in Preston, which is
Yeah, it's cool.
brilliant. Mel A Drama, if anybody'd like to go. And so you had some adult lessons, obviously, with her, which was brilliant. And you have got a natural flair, I feel that you have. And I
That's very
think
kind of you to say so. You might be biased.
no, 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 not
Yeah.
at all. I'm very honest, and you've got a real good flair for that. So you may well have been taken in a different direction had you got through that audition or chosen to be available. Who knows where
I
that
didn't
might
get
have.
through the audition, did I? Let's be fair.
But it's lovely that Mrs. Connor, was considering you for this lead, and most important, when you were at high school, how was that experience for you, Mark? How did you fit in there?
All right, yeah, it was pretty good. I I enjoyed it. I guess you never say like when you're at school, oh, I really enjoyed school. But yeah, it was pretty good. Yeah, no, I had a nice bunch of mates, got on with most people pretty easily. It was a really easy ride, I have to say, compared to what it could be. I wasn't really bullied or anything like that.
Yeah,
Didn't get in much trouble. Kept my head down.
and
Sounds
you
like prison. I kept my head down, did my time. That's
for some of us it was like prison, but
oh,
yeah, so basically you then graduate at 16, and where did you go next, Mark?
I went to Cardinal Newman College, which a ton of us did. Most people from our school who would carry on to do,
Yeah.
sixth form went to Cardinal Newman just up the road. Yeah.
And what did you study there?
Maths, physics, economics, and general studies.
Okay. And did you enjoy those?
They were all right. I liked economics. Honestly, it's always the teacher you've got. And I had a phenomenal economics teacher. He was just amazing. Mr. Murphy, made you laugh and you relaxed, and it all went in. And he knew how to teach and to teach to the exam as well. So he made life really easy.
Wow.
But yeah, it was
Wow.
cool.
And my friend Louisa Cornell, that's in my book, also giving a testimonial inside the book. She, I think, did economics, and Mr. Murphy was mentioned there as well. So he obviously was a. Just tell us a little bit about him, Mark. What's good about Mr. Murphy in terms of his teaching? What makes a good
Mr.
teacher?
Murphy, he was a big Everton fan. He was a Scouser, and he was a natural comedian as well. And so he made it funny, and he made you laugh, and he also taught at the same time. And yeah, and put you at your ease, and yeah, knew how to teach. Probably the best teacher I had as a young person. Yeah.
Wow, that's really good, because obviously you became a Tai Chi teacher. I still can't say it.
Easy for you to say.
You became a Tai Chi teacher. I'm going to say that again. So you became a Tai Chi teacher. Oh, I can't say it. We'll keep that in.
So you taught Tai Chi. Just say you taught Tai Chi.
You started to teach Tai Chi
Yeah.
in
Qigong.
later life, and so you also, brought that to the table with your classes. I feel, you bring teachers who inspire you. You try and have a little, resonance and element of what they bring, and so it's so important that when you are teaching Tai Chi, that you bring your group into a very relaxed state and things. And the same thing goes definitely when you're treating patients with the Perrin technique. You want people to feel nice and relaxed and at ease, and able to have the best treatment. So, influences in the past can definitely help support us, like through whatever we do in our life. And so Mr. Murphy was a comedic gentleman and helped you to learn the information because he was interesting and he was engaging. And I think that's so important. And so as you then went on from there, just tell us about Oxford. Tell us a little bit about what you something that you questioned. I think that's important to share.
Well, a certain percentage of people that go to Newman, they'll suggest they put you in to do the exams. Used to be exams in our days. I don't think there's exams anymore. The exams to go to Oxford. They had a bit of a thing about it. So so they mentioned to me and a few others, "Oh, would you like to do the exams?" And I was flattered. For a little while, I was flattered, and I didn't really know what I wanted to do. And with hindsight, always go with what fascinates you. I should have gone down some kind of route that is linked to training and exercise and bodybuilding and all that stuff that I liked. My dad used to say it's a shame they don't have A levels in bodybuilding, because I knew a ton about that, and you couldn't make me open my books for other stuff often, especially at A level. Yeah, so I asked my physics teacher, and I said, well, if I'm going to go to Oxford, what do you think I should do? And he said, well, you're pretty good at physics, why don't you do that? And I was like, oh, okay. So it came to be that I would have to start studying earlier than I would have done for my A levels, and I could not be bothered. That's the embarrassing truth of it, the immature truth of it. And so I opened my books one day, and I remember my friends were all out at the pub, and I closed the books, and then I went out with them, and then I said, yeah, I'm not bothering doing those exams to even try to go to Oxford, which doesn't mean I could have in any way, shape or form got in. It's just the first stage where you study for it, and then you see if you get to interview and so on. But yeah, that meant that I then filled in all my forms for, I think it was OCAS, to study physics, where I didn't have a massive amount of interest in physics. It's just I wasn't too bad at it, so I started down that road, and fortunately changed. Eventually, when I ended up going to Manchester University, I changed to economics, which suited me far better. But
Yeah, and also
yeah.
influenced by Mr. Murphy, as you've just explained. So it's interesting how, Mrs. Connor was my influence in drama initially as a young teenager,
Mhm.
and then that went on to other influences, which I explain in the book. But I think for you personally, it's lovely that you ended up doing the economics and you got your degree. But just tell us what what that journey was like, Mark, when you got to that point.
Well, as we've mentioned, at the age of 20, so in the holiday between second and third year for me, I was feeling rough anyway, and I was having good days and bad days, not really thinking that much about it. And then I was on a lad's holiday, and going out drinking and what have you, and having a good time. And then I got dehydrated and ill. Another one of my friends on that holiday got ill, and he took a while to get to feel 100% as well. Um, but yeah, I just felt rough from then on, and like really, I didn't feel well and didn't feel right, and it didn't limit the amount of study I could have done, because there's not that many hours. You're not working flat out. It's not like a 9 to 5 or 9 till 7, what have you. So yeah, I got ill and was just thinking I'll shake that off eventually. I'll shake that off eventually, and never did.
And what year was this, Mark? Can you remember?
1995, August of 95.
Mm.
Yeah, so a good long while ago.
And so what was your initial response to that? What did you in yourself think? Oh, I'm just tired.
Just tired. I mean, I was out of shape. I was big, but I was not super healthy, and I was going out drinking and what have you, and eating junk food. And I thought that's probably the cause of it. Once I finish university, I'll get fit and I'll feel better. And in the course of getting fit, I felt worse and worse. Yeah, so the symptoms got
Wow.
worse. Yeah.
And what did you do next? Because I think in the book you explain, in the last chapter of my book, you explained that you were cycling to work and doing 40-hour shift. Just tell me a little bit about that as well.
Well, yeah, when I finished, I worked at a local pub, and I was going to the gym to get in shape, and I was cycling to work quite often and working long hours, working, behind the scenes in the pub and working in the pub, and various jobs. So a lot of hours a week, and just feeling worse and worse. And just the pig-headedness of me, I just thought I'll just push harder. And it really wasn't paying, it wasn't doing me any favors. And you know, I wasn't mentioning this to anybody. I just felt worse and worse. And at night I was getting, sweats at night, and my spine was burning, and things like weird stuff that I was like, what's going on here? But I'll just kind of keep pushing.
Yeah.
Mm.
Yeah. So what you're saying is you had no idea what it was. Did you talk to anybody? Did you express to anybody what you were actually feeling?
No, not at that time. And I also, whatever macho outlook, I just thought, oh, there's no point in complaining. This is, I'm being weak or whinging, so I will keep it to myself. So yeah, I didn't mention it to anybody, other than at the very start when I came back from the holiday in 95, and just said, God, I just feel rough, and complain about it for a bit. And yeah.
Wow. And then did you eventually confide in your parents? What happened next, Mark?
Eventually it did, memory is a tricky thing, and I'm not too sure exactly how it broke down, but yeah, I think it was when I came back, maybe when I came back from Australia, because I'd done I saved up and did some traveling, which was good. And you can get away with stuff. There was times when I worked hard, but I was just feeling rough all the time. And when I got back from there, I think I mentioned it to my parents and my brothers, and that's about it, really. And then I started working. I was doing part-time work, and I didn't really tell anybody why I was doing part-time work, because I physically couldn't do those hours. I couldn't do full-time hours, and it stopped me from. Well, a lot of my friends were moving to London and getting proper jobs, and I wasn't really in a situation to be able to do that, which was very frustrating. Which I thought it'd be short-termish.
Yeah, because you got a degree in economics, and so you are an academic man, naturally, and you were then thinking, right, I mean, what were you wanting to do in your heart, Mark, next?
In my heart, well, like I'd have probably tried to get in the city or that kind of thing, or a big corporation or company and work my way up from there. Just a pretty bog standard graduate-y type job would have been what I don't know if my heart wanted it, but like that's a sensible route, and that's the next thing I would have done.
Yeah. And what you're saying is that this particular condition stopped that from being a possibility. Is that right?
Yeah. I couldn't do those hours. I couldn't work hard. I couldn't push myself. No.
So what I want to ask now, Mark, is how did that feel in the journey, the transition from graduating in economics to slowly but surely regressing in health? And what did that do to your emotional state? Because I think that's important to share. We often, all of us, including myself, we want to bury how it feels emotionally and say, I'm fine, because that's how we've lived. How did it feel emotionally to be stuck in your
Yeah,
in your situation?
Yeah, it was devastating, very difficult. Yeah, I wouldn't wish it on anybody really, and especially you're a young person with hopes and dreams, and it looks like those things aren't going to pan out the way you want them to, and over time it looks more and more certain that that's the case, which is yeah, very, very challenging, a difficult thing to go through.
What was day-to-day living like? What could you do and what couldn't you do, and what happened after you'd done anything? What were your symptoms, Mark?
Symptoms. I felt like I was constantly hungover, even when I wasn't drinking. Rough, nauseous, wake up feeling like I hadn't slept, aching. Felt like, very rarely do I get this now, but like felt like somebody's just battered you from all over your body, and you're just like bruised and knackered when you wake up. And yeah, that was kind of it. Cognitively as well, a little bit less sharp than I would otherwise be. Yeah, tiredness, that obvious bone aching tiredness, and waking, and no amount of rest will change that. That's a difficult thing to get used to.
And how did you see your future at that point? After a few years of trying and failing?
Yeah, well, it looked very bleak. Certainly before I found out about hair mineral analysis and that kind of thing, and then started working towards more alternative stuff to get me out of there. Yeah, it's like at first you're like, oh, this will change. No, it'll just be a year, just be 2 years, and then it starts dragging on, and it's 3 and it's 4, and it's like, oh, this isn't changing. Nothing is changing. This is not good.
And how did it impact on your daily life, your friendships, and your job, Mark?
Well, I certainly didn't. I work part-time, and I try to not work in the evenings in the hospitality industry, which is not what I had trained for, and not what I was happy doing, not what I wanted to do, not what a lot of people I knew were doing. So yeah, and I was stuck in Preston, didn't really have the energy to earn enough money to sustain living elsewhere. So yeah, so much more limited than I would want it to. Plus, I wasn't telling anybody that was the case. One, I certainly wasn't telling anybody I was feeling bad, but two, I wasn't telling them I was feeling ill either. And so, you separate further and further away from being genuine when you're, oh yeah, I'm great, I'm all right. And I mean, even, yeah, I think a lot of people can relate to that. The worse you feel, the less you're expressing that. Yeah, it was a challenge at that time.
And so what happened with your friendships? Did you sustain those, or were you unable to travel? How did it impact, just going back into particularly in the first 10 years, how did that impact on you mentally and physically?
Right. Well, yeah. Well, some people I lost touch with, but my old friends I stayed in contact with, and my workmates who were great, and hung out with those. But for me, there was a certain amount of shame involved in feeling ill and being weak, too, feeling really depressed and down about it, and not having my life go in the direction that I would want it to. When you remember when you're young and you're going off and doing your A-levels or going to a university, it's like, oh yeah, good for you. You are doing what society asks of you in some way. You don't even realize that you were in that conveyor belt of the next thing. And the next thing after that for me would have been, a half decent job that can pay some bills rather than working part-time, and me not explaining it. I would rather people think I was lazy than know I was ill, which is a bit weird, but that was part of the shame. In fact, yeah. Ray Perrin showed at one of the Perrin conferences, there was a study in Latin American country, and they measured the level of machismo and the outcomes for people with ME, and there was much more depression in the people who were quite macho and got ME, because that's a real blow to what you value in yourself, or what you kind of think about as your conditions of worth, or what have you. You might call it in counseling. So yeah, it was a real blow to the ego, all those kind of things. Yeah, so challenging, character building, I guess, in a way, and certainly gave me more empathy with people who were suffering or struggling than I would have had if things had gone rosily and things had gone the way I would have wanted to.
And just describe for me, as I know you said you weren't bedbound, but you were quite severe when I met you. Just describe what a daily journey would be for you. And I think you could only work perhaps 5 hours a week at Tai Chi or something at the time.
At that time, I wasn't working that much. I'd done more hours in hospitality and different stuff, but they were all part-time jobs. But with ME, I'd have a sleep in the afternoon. I'd do 1 or 2 classes a day. There'd be an hour and a half classes, and yeah, rest up around that. And, if you're resting when other people's working, people don't really notice it. At that time, I think I was rarely drinking. Occasionally, I'd go out but then it'd take me quite a while to recover. But yeah.
And so what I'm hearing you say is that your day to day, could you get up in the mornings? I mean, just to give us a picture.
Honestly,
of how it feels.
After doing years of Tai Chi, that was the one noticeable thing when I started the Perrin Technique, was I woke up feeling rough again, and I hadn't done for years. So Tai Chi was really, really good in a lot of ways over time, for just whatever it's doing, strengthening my system in some sort of way. So yeah, it was okay getting up, but it's hard to recall now, because you recall how you're feeling right now, and it's hard to project back into that. It's interesting that I'll treat patients and they'll mention a symptom, and I'll be like, oh yeah, I remember when I used to have that.
Yeah.
But I don't really think about it now, because it's not there and it doesn't bother me. I mean, I think that's across the board. Any symptoms you have of whatever illness, when they go, you forget about them pretty quickly.
And I think that's really important, taking us into a positive transition into towards the end today. It's really important that what you're sharing is that all these hybrid of symptoms, memory loss, in my case, speech, vision, hearing, depending on what part of the brain has got the overload of toxicity in Dr. Perrin's reference to this condition, those are the parts of the brain and the body that will malfunction. And in your case, you're very honest in sharing today, and thank you for that, in sharing that the greatness of today and the journey you've been on is that you actually can't recall, unless somebody triggers you by telling you a symptom, that you actually had those symptoms, which is only a positive end to today, to show that the treatment and other modalities that you've used as well do actually work in most cases. And so, would you say to somebody today that's in that bedbound state that I was in, or in a up and down state that you had, because it is a life loss, I would consider it, that's suffering, what would you say to somebody suffering today to encourage them to go on the path that you've been on, no matter how long it takes?
Somebody suffering with ME.
Yeah.
There are things that you won't have tried yet that will help you, and they might take a while, and they might take some discipline and dedication, but most likely there are things that you can do. Get your diet sorted out. If you're bedbound, this is kind of irrelevant, but pacing. Watch how much you use screens, especially small screens, and rest. Just rest by staring out the window. It's not very fun, but it will get your body in a more settled state. psychological stuff can be profoundly useful to deal with, if nothing else, to deal with the small t trauma of going through that major illness. And the Perrin technique obviously is very useful. Tai Chi, Qigong, something restful, something that gives you more energy than you put out, then that can be profoundly beneficial. But yeah, give the Perrin technique a go and give it a go for a while, and then you can judge for yourself, not by some theory, not by some paper that you read, not by somebody else's opinion, but by your own experience over a certain period of time, whether it's useful for you.
Fantastic.
That's what I do.
Fantastic, Mark. And thank you for being so brave in sharing your journey today, because you talked there about the psychological support. Now, that does not mean, and I want to emphasize, because my campaigning was to prove it's not a psychological condition,
Yeah.
but what it means is that it is a very frightening thing to happen to anybody of any age, and of course it can happen to children as young as 5. So it's so important in this particular conversation to share today that you are now studying, aren't you, at Preston College? You're now following in your father's footsteps, am I right? Because you know the psychological implications of support, mind, body, we've talked about that, are also profound. And so tell us what you're doing today, Mark.
Yeah, I kind of following in my dad's footsteps. I'm not going to be a clinical psychologist, but I'm studying counselling, and I think it's a profoundly useful thing to do, to be a bit more savvy and a bit more aware about that thing in the job that I do today, and also be more skilled at listening and empathizing and all those kind of things. Yes, I think it can be profound, and it can be part of the package of things that you access that can help you. And it is a subtle distinction, and the internet doesn't do a great job of subtle distinctions. It likes big headlines and algorithms that drive you one way or another. But yeah, ME is not all in your mind, all in your head. That isn't the case. However, there can be psychological things that you might want to resolve that will help settle your system, and in settling that system it will function better, and in functioning better may reduce your symptoms. It's
a complex jigsaw, isn't it? It's a complex jigsaw.
That's a good way of saying it.
Yeah, and I think every single patient case is unique. That's very important, which I highlight in the book. And so no two patients are the same. But the nicest thing, the most humble thing that you did for me was that you didn't tell me you had ME, because my case was extreme, wasn't it?
So you were in the early days of your illness, the first few months when we met, I think, and I didn't want to tell you that I'd had something for 20 years or something like that. I didn't want to put that on you. I didn't want to put that in your head. So I didn't tell you I had ME until you actually guessed it. You said, you're sleeping of an afternoon, what's going on here with this? And I was like, yeah, I've got that too. I just did not want to crush your dreams by saying, yeah, I've had it 20 years, you're going to be ill for 20 years or anything like that. And I just, I didn't want to do.
I think that's really important, Mark, that you were so humble, because you were pushing me in a wheelchair, you were carrying me on your back until Dr. Perrin said, no, don't carry her, which we say in the last chapter, don't carry her, because ME is to do with the structure of the spine and the flow of the cerebral spinal fluid. And so we are always told, don't start lifting any heavy weights. I used to carry heavy PA speakers. You were obviously lifting weights in a gym. So we were both putting strain on the spine, and those types of careers absolutely can end up in situations of stress to the neck and spine, and of course stress to the sympathetic nervous system that controls the lymphatic system. So the whole body of evidence that Dr. Perrin and his science produces was enough to convince myself and yourself through his treatment that it makes perfect sense. And so today, to close, I just want to say a huge thank you to you, Mark. What do you think lies ahead for you today? So are you feeling a lot better? That's the question.
Yeah, definitely. There's a big difference and a slow change in me with doing the Perrin technique. Slowly I felt better and better. People pointed out, and I can feel it in my nervous system's not as jacked. I'm feeling healthier. So yeah, good things. Who knows what exactly the future brings, but I'll study more counselling. I'll continue treating people. I might do some workshops, retreats, things like that interest me. I'll do that over time, and I'll always be learning and I'll always be studying, because this is things that fascinate me. So yeah.
You're a natural healer, and as your father said, a natural carer as well. And that really does embody who you are. I can say very sincerely that not just Dr. Perrin, but a huge thank you to you, because without both of you, I would absolutely not be here today. So thank you so, so much, Mark, for all you've done to help and support me and care for me, particularly in the worst stages years ago. And thank you for all you do and continue to do to help and support others in the community and all over the world. And I think today will encourage everybody to take stock, don't give up. And what's the last words that you would share to the ME community before we close?
Yeah, there are things out there. Get support by all means, but also look for things like pacing, like good nutrition, and potentially like the Perrin Technique that will help you feel better, because there are ways to improve.
So never give up hope. Yeah, would you
never
agree?
Give up. Yeah, exactly. You don't know what's out there. And I'd just like to say before we finish this, thank you for having me on, but more for all you've done over the years. I'm not as good at expressing how much of a help you've been, how you put us in contact with Dr. Perrin, how you've driven things forward. You suggested I be a Perrin Technique Practitioner, which I didn't mention earlier. So much you've done, and so much you're going to do. But thank you. That's all.
Mark, thank you very much, and you know, thank you for all you've done also. So let's conclude today by saying to anybody out there, if you do want to get support, there is a Perrin Technique website called the Perrin Technique. And Mark, once more, just at the end, if you want to share your contact details before we close, so that people can contact you directly for help in Lancashire, in Preston.
Yeah, they can contact me at marksingleton.me or .me. And that's my website. It's easy enough to find, or you can find it through the Find a Practitioner on the Perrin Technique website.
And so to conclude today, Mark, I just want to say thank you very much. I wish you every success ahead, and continued health and happiness in your next chapter of your life. And may you continue to help and support others the way that Dr. Perrin has helped and supported us. God bless, and thanks for coming on today and sharing your life. Thanks again.
Thank you.
Bye-bye.
Bye-bye.